Hey everyone, this is Bailey Archie. I am the incoming Vice President of Education for ISOHA, and our incoming President, Andreas, is on his way, but unfortunately our continent reps had some personal emergencies come up, so they won't be joining us, but I am looking forward to it. So could someone just tell me that you guys can hear me just to make sure? Okay, you can hear me. Great. Okay. So we will go ahead and get started with the ISOHA Asia Who's Who in Student One Health and Community Building meeting. So these are the people who helped plan the webinar. You have your Asia Continent reps, Anila and Krishna, and their email address will be displayed here in just a few minutes, so you can contact them for follow-up and that kind of thing after the webinar. And then this is me and Andreas. And Andreas will be here a little later, so he will introduce himself once he gets here. So this is just an overview of the things that we are planning on talking about today. And then here's a little bit more info about ISOHA. So the aim of ISOHA is to connect student One Health groups around the world. Anyone working at the interface of human, animal, and environmental health. And we have our outgoing executive committee. So we've rotated some executive committee positions around to better suit members' strengths. So this is our outgoing executive committee. And we have our incoming executive committee. Is anyone else from Exco here that wants to introduce themselves? I don't see anyone. Okay. And then we also have our continent representatives, and shortly there will be applications going out for the next round of continent representatives. And then here are the Asia representatives. And you can reach your Asia continent reps at this email address. And then here are a couple of our resources that we have been working on. So if you go to this link, you can see ISOHA student groups from around the world. So some of our Asia groups today will be featured on there. And if you're part of a One Health student group that is not on this map, you can go to tinyurl.com/ISOHA spreadsheet to update your club's information or add a new club, because we would love to know of your club's presence. Oh. Whoops, sorry guys, I forgot to click the screen sharing button. Can you see my screen now? Okay, I think my screen should be shared. Okay, now you can see it. Great. Thank you. Okay, I'll just go back and click through these slides real quick so you can see what I was talking about. These are webinar planners and hosts. Some pictures of ISOHA, our outgoing executive committee, continent representatives. You can reach your continent representatives at isoha.asia@gmail.com. And then we have this map of One Health student groups. So if your group is not on this map, you can visit tinyurl.com/isoha spreadsheet and add your group in. And then we have a map of One Health educational opportunities from around the world. And if you know of one, like a degree program or a summer program or internship program or anything like that, then you can submit that on our website, which is isoha1health.wordpress.com. if you know of any opportunities that are not on the map. Okay, so we're going to go ahead and go into the student group introductions. So I'm going to go down the list of the people who signed up on the Excel spreadsheet as student group representatives. Okay, so first up, I see that Puspa Rai is signed up. So I'm going to introduce you, and if you can just introduce yourself and tell us the group that you are from, that would be great. You should be able to unmute yourself now, Puspa.
Hello?
Hi, we can hear you.
Yeah, I'm Puspa Rai and I'm from ISOHA Rampur and I'm currently working as ISOHA OI Junior Ambassador in Agriculture and Forestry University. So that is my introduction.
Great, thank you. Can you say the name of your school one more time?
My university name is Agriculture and Forestry University, AFU.
Okay, great.
And
thank you.
you're welcome.
And do you have any One Health activities that your school has been doing that you want to tell us about?
One Health activities in an ISOHA Rampur as my organization. There is ISCOS committee, which is stand for Standing Committee on One Health, and from that committee we do many different types of One Health committee like public awareness on diabetes weeks. We follow that, and currently as I'm working also OI ambassador, so my focus is in animals and public health. We connect as a One Health activities. And like that.
Great,
And
yeah.
antibiotic resistance, we do that.
Okay, perfect. Thank you.
Hold on.
Okay, Gigi Wang, I will unmute you now. Okay, go ahead, Gigi.
Hello, could you hear me?
Hey, yes, we can hear you.
Oh, thank you. I'm at some slide in the next page. Maybe you can move on to the next page.
Is that it?
I didn't see my slide here. Oh, I add my slide in the Google slide with the link you sent me, my email. Oh, here's my slide. Thank you.
Okay. Mhm.
Okay. Good evening and good afternoon, everyone. My name is Gigi, and I'm the president of the One Health International Association of Nanjing Agricultural University from China. First, I'd like to introduce our university. Sorry, where's my slide?
Can you see it?
This is not mine. The former one is my slide.
I'll show you the ones that were in the PowerPoint. You can tell me if any of these look like them.
The first one with Nanjing Agricultural University. After the slide of students' introduction, that page,
Mm-hmm.
but not this one. Oh, go up, go up. It's not at this section. I still couldn't see my slide. Yeah, this one.
Right here?
Yeah, this one. Thank you. Okay. Nanjing Agricultural University is a national university with the advantage of agriculture and life science. We ranked 9th in the US Global Best Agricultural Science University in 2019, and we have 8 subject areas ranked in the top 1% of the global ranking of ESI disciplines. And we also have agricultural science, botany, and zoology ranked in the top 0.1% of this discipline ranking. Next slide, please. It's the slide after the last one. I could see it is number 17. Slide number 17.
Okay.
I still couldn't see it. It's not this one, number 17. Now I see number 20. Yeah, this one. Our club is originated from University of California, Davis. UC Davis, one of the world's famous agricultural university. They have the world's #1 veterinary medicine and the nation's #1 agriculture. Our Nanjing Agricultural University have some exchange program with UC Davis. In winters and summers, our students could visit UC Davis to explore their school life there. And the first students who been to UC Davis, they learned One Health concept there in 2012. From there, when they back to Nanjing, they brought the One Health concept back, and they all agree with this new concept. They would like to spread it in our university in China. So they set up the One Health Club there. And now we are the university club of our university. And we also have many club activities. Our club has a very close relationship with UC Davis since 2012. We are now still have regular connection with UC Davis. I will talk about it later in the next section about student life in pandemic. Okay, and we also have many other club activities such as one day on November the 3rd, we will organize some school activities for students to participate in, and we will have many workshops and long-term challenge with UC Davis, and I will also talk about it later. Also, we have some interviews with teachers and students who have some knowledge about One concept. We interview them and write articles and post on our WeChat official account. WeChat is social media which many people in China use it. So we would spread One Health concept through this way. And we all have many other informal meetings to have that students in our universities experience One Health concept. Okay, that's all for our club introduction. Thank you.
Great, thank you, Gigi. Okay, next on the list is Famida Hoke, but I'm not seeing that she is here. Okay, Maha Khan, I am unmuting you. There we go.
Hello, everyone. Can you hear me?
Yes, we can.
Okay. So this is Maha Fatma Khan. I hope you're all healthy and doing well in these challenging times. To give a brief introduction of myself, I'm currently serving as the Vice President for members at Pakistan Student One Health Association Council, or ISOHA for short. I'm a biosciences undergrad student at the National University of Sciences and Technology, Pakistan. And ISOHA is a newly formed club, and our aim is to educate the community about the concept of One Health and the importance of human, animal, and the environmental health altogether. We also conduct activities that target One Health issues in our community. Since we're new, we started our first activity with a movie screening of the 2011 film Contagion, which also shows a novel viral disease outbreak very similar to the current pandemic. We conducted this activity in the first week of January when the COVID-19 outbreak was in its initial phase. This event caught a lot of student attention and made people aware as well as curious about the then emerging coronavirus. For our next activity, we were determined to conduct a cloth bag distribution drive in order to reduce the use of plastic bags and therefore plastic pollution. But we could not go with it because a lockdown was announced soon after we planned the activity. So currently we're managing an online platform for educating the masses about One Health. We have an online blog where we post relevant contents. Our members have conducted surveys and studies about knowledge, attitudes, and practices of people towards a zoonotic disease like rabies. We also assessed the incidence of emotional abuse amongst people in the current pandemic, and our results suggested that nowadays more people are facing emotional abuse, which consequently leads to their poor mental health. And since we cannot actively conduct any physical activities these days, our team is working more on studies like these so that we can educate people and maybe plan our future activities accordingly. That will be all for the introduction for now. Thank you.
Thank you, Maha. Could you tell me the name of your university again?
National University of Sciences and Technology, Pakistan.
Okay, thank you.
Thank you.
Shiva Donji, are you here? Or Asta is also from One Health Nepal? Okay. I will unmute you, Asta.
Hello, everyone. Am I audible?
I can hear you.
Hello. Okay, thank you. I am Asta Sharma from One Health Nepal Pakliava. I'm the current president. So basically, One Health Nepal Pakliava is a group of undergraduate veterinary students. We were established on 2017 in Institute of Agriculture and Animal Science Pakliava, which is under the Tribhuvan University. And our university is located in Rupandei, which is nearby Dumbini. If you have heard, that is the birthplace of Gautam Buddha. Since establishment, we have been working on One Health approaches within our college and beyond among the community people, engaging with the students of diverse background, increasing One Health awareness and building network in and beyond our university. Yes, this is my slide. Thank you. So we have each year we have the changing community, which means a group of students have 1 year of their tenure. In my tenure, I have recently conducted a week-long program during the World Rabies Week in collaboration with different clubs within the college, which included the awareness on students and community level, poster presentation, vaccination of the community dogs was done, panel discussions and rallies were conducted on the occasion of World Rabies Week. Similarly, we also conducted an online photo contest to address the Festival of Light celebrated in Nepal, which shows the connection of human and animal with the motive of enhancing the animal welfare on the topic festival in relation with animals. Likewise, we marked this year's World Antibiotic Resistance Week by again collaborating with medical college students and a group of agriculture students on the topic One Health for Antimicrobial Resistance with two of our guest speakers. Likewise, we conducted 3 days program on community dogs with the theme of animal birth control for rabies eradication, where we castrated 3 dogs and spayed 1 dog successfully, along with awareness among community people about importance of neutering was conducted. Likewise, recently, during this corona pandemic, we conducted global 1 minute, 1 health video competition on the theme Corona Crisis and My Preparation. And we had almost 18 participants in the online video contest. These are the glimpse of our activities we have done within our college and outside our college in the community. And another our ongoing project is the extension of One Health concept to different districts of Nepal. In Nepal, we have 77 districts, and students in our universities belong to different districts of Nepal. So each individuals from our community are planning, and we are conducting the awareness of the concept of One Health itself in different districts. We have started in few districts, and this has come to an halt due to this current ongoing pandemic. And once the situation eases, we will continue that project also. And lastly, I would like to thank ISOHA for conducting such webinars. In 2019, it was like globally conducted, and this time regionally it is being conducted. So I wish ISOHA all the best, and thank you.
That was great. Thank you, Asta. Okay, Rishis Kasan, would you like to speak from UMK Student One Health? I have unmuted you.
Hello, can you hear me?
Yes, I can.
Okay, thank you, and good evening to everyone. I hope everyone's doing great right now. So my name is Rishikesan Veeraganan, introducing myself as the current president of the UMK One Health Club, Students Club from Kelantan, Malaysia. So the One Health Student Club in Malaysia is one of the many initiatives under my OHUN, which is called Malaysia One Health University Network, to generate future One Health workforce, especially targeting the undergraduate students among the member universities. So the One Health Students Club is an association that involves all the students in the faculty of veterinary medicine, which is I'm currently pursuing right now in UMK, which also stands for University of Malaysia Kelantan. So once officially registered, the membership will be open to all the students in UMK. So the UMK Student One Health Club aims to develop One Health concept where humans, animals, and environmental health are interdependent, and healthcare efforts of these three components are important and need to be done from various aspects involving workforce from various fields. So the programs that the club has been doing for the last few years were mainly organizing talk shows and games to increase the awareness to the people in the state of Kelantan, Malaysia, on specific zoonotic diseases such as pathogenic avian influenza, mosquito-borne diseases, and leptospirosis. So that is all for the introduction of our club. Thank you.
That was great. Thank you. Okay, are there any other students here that would like to introduce themselves that maybe were not on the spreadsheet or that came later? Andreas, I will unmute you.
Hello, everybody. I'm Andreas Papas. Actually, I'm not from Asia. I'm from Greece, Europe part. I am the Vice President for Education and the next President of ISOHA. And I'm sorry for this delay to my coming. I just entered. I'm happy to be here with you and to participate in your conversation.
Awesome. Thanks, Andreas. Okay, would anyone like to talk about student life in the COVID pandemic? So how your school or your student group, the challenges that they faced with the pandemic, how the leaders of the organization have managed themselves and the organization during the outbreak, and any steps that your organization is intending to take in the future in order to minimize the negative effects of the COVID crisis. So you can raise your hand and I will unmute you if you have any thoughts on this. Okay, Gigi? If you unmute yourself, you should be able to speak now.
Oh, okay. Could you hear me?
Yes, I can hear you.
Okay, I made some slides. Maybe you could move on to see my slide about our club activities in pandemic.
Great.
Yeah, here it is. Okay, I feel that the COVID-19 pandemic is an opportunity for our club to develop stronger. We held many online activities during this period, and we made many, I could say, great success. The first activities we held is called Lunchtime Challenge. Before the pandemic, our club also held these activities. At that time, it is students that they used their lunchtime to gather together and talk about one health issue, and they made presentations to compete with each other. But during the pandemic, we moved these activities all to the online. Each team need to communicate online every week to do some surveys, interview some experts to fulfill their group project. Also, This term, we invited Dr. Benny Osborne and Ms. Chris Berner from UC Davis to be our judges of these long-term challenge activities. This term, we have 40 participants who do their group 1 project, and they compete each other. This is the activity of a competition. During these activities, they have the midterm presentation to show their program to Dr. Osborne and Ms. Berner. They will give them some feedbacks on that. After the midterm presentation, each team need to hold some promotion activities to let the students in our Nanjing Agricultural Universities to know their group project, their One Health relating project. So they did many workshops, they made videos, they built some competing activities for our university students to participate in. And totally, we counted that we reached thousands of people in all of the 6 teams promotion activities in National Challenge. And the most successful promotion activities is an international workshop. Please move on to the next slide, please. Yeah, next slide. It's about the international workshop.
Okay, yes, I've changed it. I think there might just be a delay.
Oh yeah, maybe some delay. Okay, this international workshop, with the help from Dr. Benny Osborne from UC Davis, we successfully invited professors from University of Washington, University of UC Davis, and universities from China, like China Agricultural University, Chinese Academy of Agricultural Science. We gathered this kind of professors together to hold an international workshop. This was done by Tim Pittle, who won the first place in the Long-Term Challenge program. The topic of this international workshop is through the One Health concept. How could human be in harmony with marine parasites? We invited professors who are public health experts, marine ecology experts, zoology experts, parasites experts, and this is at last built a successfully One Health workshop. Everyone shared their opinion related to human, animal, and environment. So it's our great honor to invite professors from domestic and abroad to participate in this international workshop, and we benefit a lot from the bleeding of Chinese and Western thoughts. And this is about our activities during the pandemic. Thank you.
Great, thank you, Juji. Maha Khan, I see that your hand is raised. So if you unmute yourself, you should be able to speak now.
Okay, can everybody hear me?
Yes.
Yeah, thank you. Well, the current pandemic condition has definitely caused a setback for us because ISOHA had been recently launched and we had planned many activities, but we could not accomplish any of that. Our major upcoming activity focused on a marketing and community outreach. We also planned a recruitment drive to add more members to the team. But since all of this involved our physical presence and interaction with people, we couldn't do that. So we had to reconsider and replan all our activities. We figured that we can try to gain our community reach through our social media platforms, which is why we started an online blog, as I mentioned earlier. Our ISOHA blog is a One Health scientific blog where we post scientific content that can be easily understood by the layman population. However, we still find it challenging to engage the community only through online platforms. That is a challenge. To engage more people, we're planning on taking blog entries on One Health topics from students in our universities. To get an adequate response from people, we need to provide some monetary or non-monetary incentive. And our only challenge here is that we don't have funds to give prize money. So we're thinking about other non-monetary incentives that we can give to people, such as a letter of appreciation or something like that. But we do intend to post well-written content on our page. So that will
Great, thank you, Maha. Does anyone else have anything to say about student life during the pandemic? If so, you can raise your hand. Okay, if not, we will move on to talk about partnerships. Okay. So if anyone would like to talk about different partnerships that organizations have with universities, especially if there's a partnership between the international level of the organization and universities. Andreas, can you clarify what that means?
Yes, sorry, I'm back. So yes, maybe we could hear from people what kind of partnerships does your university provide on this level? I mean, on student level. And if when you have to make a project, if your professors help you in university, and if you have some sponsors that they are kind of partners and they help you with your work, this is some examples that I have in mind. I don't want to say personal experience to give you more specific examples. It's your place here. So this is some ideas. Or otherwise, other thing that you could give us an information is if you can offer kind of partnership for other One Health clubs, like if you can support other clubs with exchanges, or you could make common campaigns, or anything else you have in mind, maybe. I cannot imagine. So yes, this is the reason of this session, to see how we could interact each other. I know that when we say Asia, it's a long place, long distances and big place. But many things could happen. For example, I saw the last week and a new event around Asia is created by a club in Nepal, and it includes many other clubs around Asia, and they make a very big event on zoonotic disease. So something similar could be produced by this meeting. So yes, here is your place for discussion.
Okay, great. If anyone would like to talk about that, you can raise your hand. Okay. Gigi, if you unmute yourself, you should be able to talk.
Okay, could you hear me?
Yes, I can hear you.
Okay, the next slide, please. I made a slide for this part.
Perfect.
Okay, as I was said, our club has been developed a close relationship with UC Davis for a long time, and the institute who supports us is called Western Institute for Food Safety and Security. Sorry, I still couldn't see my slide. Is there any delay here? I don't know. Oh, here, I could say it now. Thank you.
Great.
The Western Institute for Food Safety and Security is a University of California Davis program of the School of Veterinary Medicine and the College of Agriculture and Environmental Science. Since 2015, WIFS has sponsored in-depth educational experience for graduate, PhD students, and faculty to learn about the importance for applying a One Health approach to solving problems concerning food safety and security and animal health. And they successfully sponsored the One Health conference for more than 500 participants, including students and faculty from universities throughout China. That's what I'm talking about, the exchange program with Nanjing Agricultural University and UC Davis. That the arrange of our club, I could say. And I'd like to introduce these two great people to you. They are Dr. Osborne and Chris. Dr. Osborne is the director of outreach and training at the Western Institute for Food Safety and Security, and he's also the Dean Emeritus of the School of Veterinary Medicine of UC Davis for 15 years. It was because Dr. Osborne that the School of Veterinary Medicine in UC Davis became the #1 in the world. And Chris Berna, she's the Communication and International Program Coordinator for WIFS. She is the Principal Liaison for WIFS Guidance with International Students One Health Clubs. We have regular communication with WIFS, especially Dr. Osborne and Chris. We share our opinions. We have chats together about our activities. How could we hold better activities like that international workshop I talked before? It was all support by Dr. Osborne that we could successfully invite professors from University of Washington and UC Davis. And I could say that our club built because of Dr. Osborne and Chris. They support us a lot for our club building, and they help us connect with the One Health Club in UC Davis. We once have once or two workshops with their One Health Club in Davis, yes, we have a great relationship with them. Dr. Osborne and Chris is like our club's grandpa and grandma. We share many hobbies together, I could say. So our students, our club members are very fond of them for their great help to our club building. Yeah, that's our club story with Western Institute for Food and Safety, UC Davis. Thank you.
That's really cool, Gigi, that you guys were able to establish an international partnership. Could you tell us a little bit more about how you established the relationship and any tips that you might have for clubs that are considering a partnership with a school in another country?
I think it's first because of our Nanjing Agricultural University have the exchange students program with UC Davis. That's the first step for our clubs to build this kind of relationships with UC Davis. That's the original important things. And another important thing I think is you need to invite them to participate in your activities, like our long-term challenge. We invite Dr. Osborne and Chris to be the judges of our long-term challenge, and we organize many Zoom meetings. On these online Zoom meetings, Dr. Osborne would offer many his suggestions to the long-term challenge teams about One Health, how to relate their project with One Health. Apart from these club activities, you need to, I could say, write email very often with them. Share your opinion, share your ideas about how would you like to build your club. Yeah, that's I could say it's our experience. Thank you.
That's great. Thank you. Okay, would anyone else like to share about their partnerships or maybe questions they have about partnerships? We'd love to hear your experience, good or bad, no matter how big or small. Okay, Maha, go ahead.
So I'm really happy to see the work and achievements of other groups, and this really gives us an opportunity of learning as an organization. So as of now, ISOHA is not engaged in any partnerships with local or international organizations, although our team members are working effortlessly to bring sponsorships and collaborations, but the pandemic has hit businesses hard, and thus our search as of now has been unfruitful. We would really appreciate any guidance and support that ISOHA can provide on the matter. Thank you.
Great, thank you. And also, I saw a question about this in the question box, but someone asked, how can I start a One Health Club? And ISOHA has a club startup toolkit that we can share after this meeting. So that might be helpful for people who have already established clubs and people who are looking to start up clubs. Does anyone else want to say anything about partnerships? Do we have any professors or teachers here that would maybe want to talk about, how can a teacher or faculty mentor support a student group? If so, you can raise your hand. Okay, I think we can move on to talk about income. So if your organization has a fee system that allows you to do your activities and all of that, we would love to hear about that. So yes, do you have any partners that maybe help you with your finances through sponsorships, or do your members pay dues to your club, or do your members not pay dues to your club? We'd love to hear about that, so you can raise your hand if you would like to speak.
I could also make some suggestions. I mean, how they could people answer here. I mean, you can also tell us about sponsors, or in general how you gain money and how you manage money. I mean, even bank account is a problem sometimes. So if you face such problems, just mention to us so we can know what is happening around the world. Another issue could be like how you spend this money. Do you give to students, or you have to pay for your campaigns or whatever else? We have
Thanks for
like
clarifying.
yeah, We have a lot of people here. You can say something. Don't hesitate.
Or if we have any professors or teachers here, they can maybe give suggestions on how clubs can handle finances. Okay, Gigi, you can go ahead.
Okay, I'm also curious about these questions because our club don't have some financial problems. We are a students organization under the Office of International Relationship of Nanjing Agricultural University. So the Office of International Relationship, they fund us, they pay for our money that should be used in our activities. So we don't have this financial situation. And our club members don't need to pay for any campaign or activities. But I'm also curious about how other One Club they gather some help for the finance problem. Yeah, thank you.
Great. Yeah, that's really good to know. That's a good idea to maybe check with your university's administration to see if they have some sort of Office of International Partnerships that would give you some funding. So that's a great idea. Is anyone else? You can raise your hand if you have any thoughts on this. Okay, Naman Bashir, did you have your hand raised? If you unmute yourself, you should be able to speak now.
Hello, everyone. Can you hear me?
It's a little bit unclear.
Hello, everyone.
That's better.
Okay, thank you. I am Dr. Bashir, and I am a doctor of veterinary medicine. I am doing MSc on livestock management, and I had completed my fellowship in One Health program. And basically, I am a health leader in my university, and I am also working on One Health project in the area of local areas, or basically related to the villages. So I will give guidance about the how we can get funding about our projects for our One Health groups. Every university has their ORIC sessions and platform where the students of every group related to any kind of research or opportunities, they can make their projects and they can submit there and defend them, and they provide adequate funding for their completion of projects. Basically, they help out for small fundings, but if the project is very good enough, they can help out for the big projects related to the university students only. So this is these kind of the
I think you muted yourself. Oh, there we go. I think you're back.
okay. I was talking about that these kind of opportunities are available at every university platform, So every One Health group members can seek their guidance from their teachers, and the group representatives can meet even the VCs of their universities or administration, so they can make different projects about One Health in person, so they can fund them, and this also helps out the increasing the ranking of university, and they should enhance their scope internationally. Moreover, the other different kind of opportunities are available through the different platforms internationally. They give funding like UNO, United Nations, different projects. They help out the different organizations and clubs for their projects. So you can be able to get funding if you have great thoughts and great projects. Thank you.
Great, thank you.
I have one suggestion more, that likewise that we are doing the One Health meeting webinar. It will be helpful if we conduct meetings on the monthly basis in the every zone, like Asia and other club members or representatives would be able to join these meetings, and they can share their ideas and their projects they are performing in local areas or in universities, so that everyone can get the ideas and take actions accordingly in their local cities. That will be helpful for everyone to get to know, and brainstorming sessions will be helpful for every group and group members. Thank you.
Okay, great. That's a good idea. If you want to get in touch with the ISOHA Asia continent representatives about that, that would be perfect. And ISOHA Executive Committee is happy to try to support that. And so, that's great.
Okay, thank you.
Does anyone else have any thoughts on partnerships? Oh, Maha, your hand's raised. Okay.
Okay, I wanted to talk about the income. Currently, PSOHA depends on the funds that are granted to us by our host institute, that is my university, National University of Sciences and Technology, Pakistan. However, I can tell you about our future plans that we have to formally launch several different sources of fundings. One, we can resume our on-ground activities. These would include sponsorships and several revenue generating streams, which would focus largely on selling our merchandise, which would possibly include selling cloth bags as an alternative to plastic bags. That's just one of the things that we were thinking of, but we would really appreciate ISOHA's guidance on this matter. Thank you.
Great, thanks for sharing. And ISOHA, we're in the process of developing our own fundraising too, but we can certainly ask our fundraising chair to speak with you and perhaps share any ideas that they might have. Okay, would anyone else like to talk about income? You can raise your hand if so. Okay, I think we can, before we move on, I think if our students who first introduced themselves are still here, that would be great to hear a little bit about how your group handles funding. So Puspa, if you're still here, we'd love to hear your thoughts.
On income? Hello?
Yes. Yes, or if you, you know, even if your club does everything without income, we would just love to hear how you manage that.
For in our club, we generally take membership fee just like little bit, not much more. And for any project we ask help from the agriculture, we ask help from the administrations, and they will help in some projects but not for the all. And for other fundings, and source source out, we give them our proposals, and if they accept, they will provide funding for some of the project. Like this way we will source fund for our programs. And generally we collect money from our student to make the programs happen. Like this way we run our program and collect some funds. Sometimes we organize different types of activities and where we can collect funds for any programs. So like this way we are collecting and doing our programs. So that's all. Thank you.
Great, thank you.
Sorry, I was not here before. Maybe you said that. But where are you from, Puspa? From which country?
I'm from Nepal.
Okay, okay, thank you.
Asta, if you're still here, do you mind talking about how your club handles it? Okay, I think she is gone. Rishikesan, would you like to talk about it for your group? Just going through the list of the groups we have represented. Okay, I'm having a little bit of trouble unmuting his telephone. Okay, next we can move on to talk about the future of ISOHA. So we would like to hear about things that you would like to see from ISOHA, things that would be helpful to your club. And we would also like to know your thoughts on ISOHA membership. So not necessarily having to do with funding, but if you think that submitting a form to be a member of ISOHA would be helpful, or would help people feel a little more invested or a part of ISOHA. But before we get to that, I see that Ali has raised his hand.
Hello, everyone. Can you listen me?
Yes, I can hear you.
First, I introduce myself. I am Alif Sham. I am student of Doctor of Veterinary Medicine. I am currently enrolled myself in University of Veterinary Animal Sciences from Lahore, Pakistan. I want to just add about partnership. As our university producing graduates every year, we conduct in our degree we conduct a different free treatment camps, vaccination camp, or deworming camp. Like in order to support us, we talk about our professors and as well as pharmaceutical companies. They support us financially and medicinally, and so we perform our events smoothly and finely. Just want to add that if we talk about partnerships, we can contact our pharmaceutical companies or relevant department of I mean to say relevant in matlab departments, so we get support from them and can perform our event smoothly. That's all about. Thank you.
Great, thank you. And can you tell me the name of your club and your university again, please?
Okay, my university name, University of Veterinary Animal Sciences, Lahore. In addition to, I want to add about my university. Recently, our university has made biosafety lab 3, which support and increases the increase the testing capacity for coronaviruses, COVID-19 kit. And our we are studying, as I am studying in veterinary university, we also have aimed at in sport to one health, we have aimed at zero rabies by 2030. That our also in our motive. And currently I am also junior ambassador at OI Health. Thank you.
Perfect, great. Thank you for sharing. Okay, would anyone else like to talk about the future of ISOHA? So their thoughts on a more formal membership process for ISOHA, not necessarily including dues, but maybe just a way to apply or submit a form showing that you would like to be in ISOHA, or things that you would like to see from ISOHA.
Can I start with something? I can say something from ISOHA side. So as upcoming president for the next year, what I would like to see as ISOHA from the several One Health clubs would be to have a meeting with them. I would like to have a meeting with every separate One Health club of you to discuss and see how you are moving there, and yes, and meet your people there. I mean, it's one of my goals and my dreams for the next year from ISOHA side. So, what would you like to see from us? I mean, now we have some projects like our journal that I know that some of you have written on that, and we have a delay because it's the first one. We have the mentorship program that maybe some of you participated. I'm not sure. I don't remember the names. And we have several webinars, and finally the Who's Who webinar. So what else could be included to make our work better and our connection between you and us stronger?
Okay, Gigi, you can go ahead.
Okay, could you hear me?
Yes.
Hi, Andrew. I'm very impressed about what you have just talked about. You said that you would like to meet every separate One Health Club in Asia who is now participating in this webinar, and you would like to meet our club members separately. I'm really looking forward to that. Our club would like to invite you to our online meeting, and we could discuss about more details of how could we co-organize some activities together. And also, I remember there's someone mentioned that he would like to ISOHA to organize the online meeting once a month for all the Asian One Health clubs to gather together and share their recent activities, their recent outcome of their program. I think our club would like to join this kind of meeting once a month, because I think it's a great idea for us, our Asian One Club, to exchange our recent ideas, recent activities. And also, I have one ideas more that I would like to invite some Asian One Health Club if you have some interested in our club's activities, such as the lunchtime challenge I was talking about. Lunchtime challenge, we invite professors from UC Davis to be judges. This is kind of competition between each teams. So we'd like to invite students from other countries like Nepal, Pakistan, Malaysia, to participate in this lunchtime challenge competition with our One Health Club students in China together to have the team building activities. We will focus on a One Health concept, One Health problem together, and we will show our work to the professors in UC Davis at the midterm report and final report presentations. So I don't know if you guys have any interest to join our long-term challenge. Yeah, you could talk about it later. Thank you.
Great, thank you. That's very nice of you to extend the invitation. And just a reminder, if anyone needs to get in touch with anyone else from the webinar today, you can see email addresses on the Google Doc spreadsheet that you signed up on. Would anyone else like to talk about future plans for their club or future collaborations with ISOHA? Okay, great. So anyone else who is here tuning in and would like to introduce themselves and just tell us where you're from, what you do, if you're a professor, maybe any advice you have for students or anyone wanting to pursue a One Health career, we would love to hear from you. So feel free to raise your hand. Okay, great. Ma, your hand is raised and you can go ahead and speak.
Can you hear me?
Yes, I can hear you.
Okay, thank you. And I'm from NAU One Health. I'm from the same organization from which is GG come from, and we're from China. And I've heard that she and Andrew, is that right, Andrew, or that they suggest that we should building our connections between our One Health Club and other clubs from different countries. So maybe if we can have our how can I say, like email address, like we can have our email address for each other from for the every from this conference participants, like this today's conference. So can we just get the email address for others participants?
Yes, unless anyone is opposed. If you're opposed, please speak up. But otherwise, I can send the email addresses of everyone that attended today to the ISOHA continent reps, and they can, maybe distribute the email list, or they can start an email list themselves, something like that.
And I think all of us shouldn't be so afraid of speak out, and maybe you can just sign email first to try if there gonna be any how can I say you can maybe you can receive my, if you send email, maybe you can just receive the letters come from the one you gonna to get touch with. So so I'm here to call for all of us just try to send some emails or try other ways to get connections with other participants. So thank you. That's my ideas.
Great, thank you. That's a good idea. Noman, I saw that you asked me to repeat. I'm not sure what you wanted me to repeat. Was it just about, establishing future connections? Or I also asked, if anyone else that was present today would like to introduce themselves, they can feel free to do that. Okay, and oh, got a question. Okay. So I mentioned this earlier, but if your student group is not on our master list, please add it. That would be very helpful for us and will help us facilitate collaboration across the world and across Asia. So you can visit this link, tinyurl.com/ISOHA spreadsheet. And thank you very much for joining us. Please follow us on Facebook. Here is the general ISOHA Executive Council email address, and then this is the email address for your Asia reps. So I would just encourage them to encourage them to put on the monthly meetings if that is something that you guys would like to have. And also be on the lookout for applications for continent representative positions and educational committee positions. Andres, would you like to say anything else? Oh, Gigi, your hand's raised. Okay, we'll go to Gigi, then Andres. Okay, go ahead, Gigi.
Okay. I'd like to add that I'm wondering how could our One Health Club members be members of ISOHA? We'd like to do something for our Asian One Health Clubs to co-organize activity together. I think if we could join ISOHA and to be a member of ISOHA, it may be more easier for us to gather the One Health Clubs together to organize some activities. Yeah, thank you.
So yeah, it's something that we are developing. It's very hard to start something like this because usually if you check the rest organizations around the world, usually there is a kind of membership fee that they pay and then they become official members of this organization. But here for us it's difficult because most of the people are coming from countries with low income, so it makes things more difficult for us. So it's something that we try to develop. If you find any idea or you have specific experience that you can share with us to help us on this, it will help a lot. But as this first step, we have this official list of the One Health clubs that is existing on the world. So they automatically receive emails from us with information from everything. And we also have this Google form that people can apply individually, and they can be part of our serve listserv. Yes, this is the first two steps that we have done till now, but we are trying our best to make the organization more, I don't know how to express it, more official, so you can more officially participate in our project. Now it's free and open for everybody, but we try to find some ways to have some specific gifts for our members. I don't mean something, just something separate for them, so to make people come in our team. So anybody who have some ideas can easily come to us and help us with that. Just to mention again that we are looking for content representatives, and most probably it will be some people from this team here. So don't lose the applications and just do it. And if you need more information about the position, let us know so we can bring you in contact with previous continent reps and they can help you on that.
Okay, thank you, Andrew. I'm really looking forward to that. And as you mentioned, you would like to meet One Health Club separately. And if you would like to have some meeting with our One Health International Association from Nanjing Agricultural University, I'd really appreciate that. You could email me and we will discuss the time for that kind of meeting. Thank you.
For sure, we will do it. It's one of my goals and dreams for this year. So, you know, when you have a dream and you are in my age, for sure you make it. So be ready.
Yeah, thank you. We're looking forward to that.
Great. And Gigi, going back to your question, if you go look at this spreadsheet, it'll show you the list of groups that we currently have knowledge of in Asia. So in contact email addresses for that as well. So that can help with communication, but we will also ask the Asia continent representatives to start an email list of everyone that attended today.
Okay, thank you for the email list.
Sure. You're welcome. Okay. I think that is about it for today. And I will also be sure to send a link to both the One Health Commission listserv and the ISOHA listserv in the follow-up email. So be sure that you and your club members are subscribed to those. They're just email lists that we send out mass emails through, and that'll give you the most comprehensive updates on what is happening in One Health around the world and with what ISOHA is doing. And we could not do this without the One Health Commission. So we're very grateful for them for allowing us to use GoToWebinar. So thank you all very much for coming, and please stay in touch and hope you have a great day.
Bye, everyone. Thank you very much for coming.
Or have a good night. It's probably nighttime for you guys.